For me, participating in the Marie Curie Action programs means to be part of a group of people from different fields who come together with a shared goal: improving patient life. One of the things I value more about this action program is the strong spirit of collaboration. Today, science is no longer isolated, and real progress happens when researchers, clinicians, and industry work together. Thanks to this fellowship, I have the opportunity to return to Spain after completing my postdoctoral research at the Institut Pasteur in France, and joined the Polymer Therapeutic Lab, led by María Jesús Vicente. In our lab, we not only study the mechanisms involved in the tumor progression, but we also develop nanomedicine strategies that could help to stop or at least reduce the progression of the disease. The program has also given me the opportunity to collaborate with clinicians from the Hospital del Mar, as well as with industry partners like Sarbatec, a biotech company specialized in bioinformatics and genomic analysis. In conclusion, Marie Curie Actions fills the gap between academia, clinical research, and industry, because biomedical research should not remain only in scientific publication. It should reach patients and make a real impact on society. Between the opportunities that Marie Curie Action Program gives me is the possibility to work in an interdisciplinary research, working closely hand by hand with chemist people, clinical researchers, and industry. Also, I have the opportunity to strengthen scientific networking. I'm collaborating with leading groups in cancer research in Spain and across Europe. And finally, benefit from diverse advanced training courses that are designed not only for me to improve like a scientific, also for my future career. Breast cancer is one of the most common cancers worldwide. Even though treatment have improved a lot over the last 25 years, metastatic breast cancer is still a major challenge in oncology. In fact, only around 20% of the women diagnosed with metastatic breast cancer survive more than 5 years after diagnosis. One of the reasons is that current treatments are often not specific enough and cause important side effects, which greatly affect patient quality of life. That is why there is still a strong necessity to improve the therapy. My project here, called Tunnel Nanometer, studies how breast cancer cells communicate with the tumor microenvironment through tiny cellular bridges called tunneling nanotypes that interchange mitochondria between them, and other things like, for example, COVID-19. This transfer of mitochondria has been linked to tumor aggressiveness and resistance to treatment. The idea of the project is not only better understand this mechanism, but also to be able to block it using nanomedicine approach. We are developing nanoconjugates that specifically target mitochondria, with the goal of interfering with this harmful communication and reduce toxicity compared to conventional chemotherapy. At the same time, we are also exploring the identification of new biomarkers associated with mitochondrial transfer and metastatic breast cancer that could eventually be used as a therapeutic target or for patient stratification. Overall, the project combines basic science with a translational perspective, aiming to contribute to more precise and effective therapies for aggressive breast cancers while reduce side effects. What motivates me most is first, the curiosity. I want to understand the different mechanisms that tumor cells use to coordinate their behavior and adapt to changing environments. Second, by the challenge of design innovative nanoconjugates capable of overcoming the limitation of conventional therapy. And finally, and most importantly, I'm driven by the opportunity to improve patient outcomes and enhance patient quality of life through my research project. In conclusion, to advance of precision medicine to more personalized therapies in oncology. I hope this research will help develop more effective and personalized therapies for metastatic breast cancer patients, especially for aggressive and treatment-resistant tumors. I also hope my work in nanomedicines and target therapies can eventually reach clinical application, not only in cancer, maybe establish the basis for the treatment of other diseases, such as neurodegenerative disease, where the transfer of mitochondria through these connections also have related with the progression of the disease. Personally, I would like to continue working across disciplines such as cancer biology, chemistry, and translational medicine, because I really believe collaboration is essential to solving complex biological problems. Finally, I hope my experience through Marie Curie Action Program will help me to grow as an independent scientific, develop innovative research, and mentor future researchers while contributing to collaborative science in Europe.